Chapter 3, Communication for Correctional Officers. Page 75, Unit 1, Fundamentals of Communication. Lesson 1, Communication Basics. Lesson goal. At the end of this lesson, you will be able to use basic communication skills with inmates and others.
Think about this. An upset inmate approaches you complaining that their canteen items keep disappearing. As the inmate is talking, their voice gets louder and their face turns red. What communication techniques could you use to respond to the situation?
An important part of a correctional officer's duties is to communicate with and manage a diverse correctional facility population. To achieve this, correctional officers use a variety of skills that include interpersonal communication, verbal and nonverbal communication, situational awareness, verbal commands, command presence, and courtesy.
These skills not only demonstrate professionalism, but also help create effective interpersonal relationships and reduce tension. For example, if an inmate is acting out, communicating properly with them could de-escalate the situation.
Elements of communication. Communication involves the exchange of verbal and nonverbal messages. Communication methods include spoken or written language, gestures, facial expressions, active listening, and body movement.
For communication to occur, the speaker must send their message in a way that the listener will understand. Then, the listener can show that they understand by responding.
Mastering the basic skills of effective communication is a necessity for navigating your daily job tasks, and it is more than just talking and listening to someone. It involves understanding emotion and the intention behind the information exchanged. You should be able to clearly convey a message and listen to the meaning of what is being said while ensuring the other person feels heard and understood.
Plan your interactions by following these guidelines for communication. Consider what you want to say and construct the message in your head. Convey the message via verbal, nonverbal, telecommunication, or written format to the person or group to whom it is intended. Allow time for the person or group to receive and understand the message. Gauge whether you have received an appropriate response or change in behavior from the person or group you addressed.
Consider the elements of effective communication and how mastering the basic skills is a necessity. Communication involves the exchange of verbal and nonverbal messages. Consider what you want to say. Convey your message. Allow time for the other party to respond and understand the message. Then gauge that response. Did you receive an appropriate response?
As you gain experience and consistently practice effective interpersonal communication, you will continually improve your verbal and nonverbal skills. Characteristics of an effective communicator: professionalism.
Professionalism is behavior that demonstrates good character and is marked by pride in yourself and your career. The characteristics of a professional include service, integrity, respect, quality, fairness, honesty, courage, compassion, moral and ethical leadership, trustworthiness, and common sense. Some examples of professionalism include
Knowing your role and being competent, dressing professionally, maintaining a calm presence, recognizing and admitting your mistakes, being courteous, maintaining your training and continuing education.
You represent your agency when you are in and out of uniform, so you must be mindful of your attitude and assume one that supports the professional behavior expected of you on and off duty.
Your attitude shapes your expectations of what will happen in any given situation, and it affects how people perceive you. An officer with a professional and positive attitude is a valuable member of society and corrections. Courtesy is being respectful when interacting with others and treating them in a dignified manner, regardless of their status, race, gender, appearance, or behavior. If you regularly address inmates with contempt or disregard, you are likely to develop hostile relationships.
If you routinely express professionalism and respect for others, then respectful, professional relationships are more likely to develop. Maintaining a professional and courteous relationship is important because this may help you avoid or de-escalate, potentially, violent situations.
Active listening. You should never allow personal judgment or bias to obscure your ability to listen. Active listening requires giving full attention to what is being said and taking time to understand the message without interrupting. Good listening skills require a great deal of practice and are essential for effective communication. The elements of active listening include the following: maintaining eye contact and facing the speaker, keeping an open mind and avoiding bias to hear all the facts, identifying key words that should alert you, such as kill, suicide, getting out, and hang, identifying the intensity of speech in terms of voice volume, emotion, pitch, and tone, paraphrasing back to someone what they said to ensure you properly understood the message, asking questions for clarification or more information.
Taking the time to listen carefully by rephrasing what you heard and clarifying statements will let the other person know that you heard their concerns. Doing so can encourage them to speak more freely, allowing you to gather information. Active listening can also be a way to help an inmate release frustration. Become familiar with the behavioral patterns of the inmates you manage. Consider the speaker and try to determine if the statements that the person made are typical or if something unusual may be going on. Being aware of subtle differences that could indicate potential conflict may help you anticipate ways to prevent or manage such situations. The ability to listen carefully is critical to officer safety. Empathy. Think of empathy as a tactic you can use to help in the situations you will encounter as a correctional officer. Empathy is the ability to understand and care about the emotions of others. Empathy should not be confused with sympathy, which is a feeling of sincere concern for someone who is experiencing something difficult or painful. Sympathy engages emotions and the potential for actions causing you to compromise your authority. Empathy allows you to connect with someone. When you are empathetic, you think about how that person must be feeling and how you would feel in that same situation.
Use empathy to put yourself in another person's shoes. If you were in their situation, consider whether you would want to be listened to, be treated with respect and fairness, and understand what was going on. These behaviors may seem basic, but in a stressful or volatile encounter, empathy can mean the difference between escalating into violence or keeping everyone safe and secure. Officers can use empathy in many settings to help keep situations safe for everyone. For example, you may be tasked with informing an inmate about a death in their family. Use empathy to help navigate the situation, but also keep in mind that you should not let yourself become too emotionally involved.
Trauma-informed approach. Trauma is an event or ongoing experience that is emotionally or physically damaging to a person and overwhelms the person's ability to cope.
The human body can handle many stressful events, but traumatic events can cause individuals to stay in stress response mode. When in a heightened state of stress, a person may perceive various events and routines as threatening, such as loud voices, strip searches, and banging doors, and react as if the threat is present. Trauma can have many causes, including childhood abuse, physical or sexual assault, domestic abuse, natural or man-made disasters, and the death or loss of a family member. 4 major emotions that can present in trauma survivors are anger, guilt, fear, and depression.
Violence and trauma can have a profound impact on a person's daily life and how they react to others, so it can make communicating with them a challenge. Being in a correctional setting could further exacerbate trauma symptoms, which may include being avoidant, easily startled or frightened, and irritable with angry outbursts as well as exhibiting aggressive behaviors. severe emotional distress, and physical reactions to things that remind them of trauma.
A history of trauma is not the cause of all behavioral issues in inmates, nor is it an excuse for inmates to engage in dangerous or disruptive behaviors. Understanding the impact trauma can have on one's ability to react to stress can help correctional officers communicate and problem solve more efficiently with inmates.
Keep the following in mind when communicating. Be sure to speak with inmates and coworkers in a respectful manner. Be mindful of noise levels. Speak softly when possible. Assert authority without resorting to shouting or yelling. Practice patience and active listening.
Diversity of population. When you enter a correctional facility, you are exposed to an environment that includes many different people and personalities. Do not assume that you can communicate effectively with all inmates and staff using the same methods. One communication style might not work well across cultures, so be mindful of how you communicate. Furthermore, do not allow racial stereotypes to influence how you communicate with an inmate. You cannot assume an inmate's racial identity based on physical appearance alone. You will encounter many types of people in a facility, and each person should be treated with dignity and respect regardless of their appearance. When interacting with inmates of the opposite sex, take extra precautions to avoid any appearance of impropriety. For example, avoid being overly friendly or becoming too familiar. With inmates of the opposite sex, it is also important to exercise caution when interacting with inmates of the same sex to avoid any potential misunderstandings or allegations of inappropriate behavior. Take steps to keep conversations as neutral as possible and avoid non-work-related personal conversations to prevent possible manipulation. Even the perception of favoritism can damage your professional reputation.
Always strive to interact respectfully as a professional representing your agency. Avoid negative interactions with inmates and staff based on their differences. By understanding diverse populations, you will be able to communicate with others more effectively.
Intercultural communication. As a correctional officer, you must understand the significance of culture and how it affects communication. Culture can be defined as the customary beliefs, social norms, and significant traits prevalent in a group of people or particular place.
Intercultural communication takes place when people from different cultures communicate, and intercultural can refer to interethnic, interreligious, or interregional communication as well as communication between genders. When intercultural communication is done poorly, it can lead to miscommunication and division between you and inmates. For instance, some gestures may have different cultural or social meanings to different people or groups. Examples of this include lack of eye contact, shaking hands, hand gestures, bowing, and use of personal space. In some cultures, direct eye contact is seen as being open and honest, while in others, it could be seen as impolite or disrespectful. In order to improve your intercultural communication, you must learn to be culturally responsive, which is when you are open to learning about new cultures, respectful of cultural differences, and able to recognize the important role that culture plays in a person's life. Page 80. Unit 1, Fundamentals of Communication. Lesson 2, Verbal and Nonverbal Communication.
Lesson goal. At the end of this lesson, you will be able to interpret nonverbal and verbal communication.
Think about this. As you are walking to your car at the end of your shift, a coworker brushes past you and looks upset. When you ask them if they are okay, they look down and mumble, "I'm fine." What are their verbal and nonverbal cues telling you?
Communication goes far beyond the words people use. When people communicate, they do so not only through how they use their voice, but also through body language and facial expressions. Correctional officers must be mindful of how they communicate as it can be the difference between a peaceful resolution and an escalating incident. The more you understand verbal and nonverbal cues, the greater your ability to communicate and choose responses appropriately. Constantly evaluating how you communicate verbally and nonverbally to those around you is important to your role and ultimately your safety.
Evaluating verbal and nonverbal cues. Part of how people communicate is through verbal communication, which is what someone says with their words. This includes voice and tone. For example, you may observe that an inmate's verbal communication during a routine search seems flat and unemotional, while another is loud and expressive. Verbal communication consists of not only what someone says, but how they say it. Be mindful of how loudly you speak and your tone and inflection. Pay attention to verbal cues and ask yourself the following. What is the tone, volume, and pitch of the person's voice? Does the tone of the voice indicate sarcasm, confidence, compassion, anger, or another emotion? What words are used and how are they spoken?
The other part of communication involves nonverbal communication, which is any message or signal sent from one person to another without the explicit use of language. Unlike verbal communication, nonverbal communication directly relates to how a person carries themselves while communicating. When you assess nonverbal communication, you observe a person's posture, body movement, facial expressions, eye contact, and smell.
Posture refers to the way a person sits, walks, and stands. It can include a person's bearing, subtle movements, and general presence. Ask yourself the following when evaluating posture. When you question an inmate about an incident that occurred during mealtime, does the person shift their weight or suddenly cross their arms? Does someone's nonverbal communication match what they are saying to you? Does the person's posture help validate or contradict what they say?
Body movement can offer vital nonverbal cues. People use their bodies to communicate their attitude or emotional state in various ways, including by facing, leaning toward, or moving away from someone, shuffling their feet, rocking back and forth, or side to side, darting their eyes, shaking their legs, and twisting their hands.
Keep in mind that these behaviors could indicate that a person is nervous and trying to self-soothe, or they could indicate a fight or flight response. It is equally important to consider that people with mental health issues can present similar indicators, but may not be in fight or flight mode. Ask yourself the following when evaluating body movement.
When you talk to an inmate, what is your body language saying? Do you lean forward to indicate interest? Does the person you are talking to exhibit physical indicators, including rocking back and forth, darting their eyes, or shaking their legs? Does their body movement contradict their words?
Facial expressions are another important nonverbal cue. People are able to express emotions through their facial expressions without saying a word. Many facial expressions are universal. For example, the facial expressions for sorrow, joy, surprise, rage, disgust, and terror are the same across most cultures.
When communicating with others, listen attentively and observe the person's facial expressions. It may help to ask yourself, what facial expression is this person making, and does it provide additional information? Does the person's facial expression match the verbal message they are sending? Person may tell you that they are fine, but their facial expression may contradict their words. The following are some facial expressions to look for to determine someone's true feelings and emotions. Excessive or no blinking. Seeing a lot of white in the eyes. Scratching or touching one's nose. Biting one's lip or touching one's mouth. Smiling or frowning.
Just as with facial expressions, eye contact can communicate a lot about a person. Your ability to establish, maintain, and understand eye contact will enhance your ability to communicate effectively. Factors such as personality, cultural background, Nervous tension, medical condition, and emotional state can influence eye contact. Use your knowledge of eye contact to help determine someone's emotional state. Smell is a nonverbal cue that may not be thought of as often, and it can sometimes be a barrier to communication. For example, some people may not share your expectations of personal hygiene, may have certain medical conditions, or may have dietary restrictions that cause them to smell differently. Someone suffering from depression or someone who is suicidal could also have issues with personal hygiene. Avoid making false judgments about people with whom you interact. Effectively, evaluating your verbal and nonverbal communication will prove useful when you have to perform your duties. As a general rule, evaluate verbal and nonverbal behaviors within the entire context of what is going on, taking cultural factors into consideration. All communication is subject to misinterpretation because people may react differently in stressful situations.
Command presence. Just as an officer watches inmates for nonverbal messages and behavior, an officer should also use nonverbal techniques, such as positioning and posture, to communicate to inmates. All officers must exhibit command presence, which is body language that projects confidence, dense, poise, and professionalism. When approaching an inmate, keep yourself at a safe distance, yet stay close enough to see and hear. Face the inmate directly and look them in the eye. This conveys that you are focused, attentive, and in charge. Stand upright, eliminate distracting behaviors, and lean slightly forward. Command presence also includes personal grooming and maintaining a clean, neat uniform. An officer that maintains their uniform, as well as a clean appearance, gives the impression that they are professional and, therefore, may be more likely to command attention and respect than an officer that does not take care of their uniform or appearance.
Learn to use direct verbal commands to communicate desired actions or behavior to inmates. A verbal command is a spoken command that is used to direct, influence, or give orders to a person or group. You will often issue verbal commands to inmates to clearly indicate what is required. Be specific when you give directions. Examples of verbal commands include the following: mop the floor, move back to your bunks, clean your cell before breakfast. While using command presence sets a professional tone, do not abuse your authority or bully anyone. A show of force is not always the best response. Always treat inmates as you would anyone else. Just because inmates are confined does not mean that they should be treated with disrespect.
Page 83. Unit 1, Fundamentals of Communication. Lesson 3, Conflict Resolution and De-escalation. Lesson goal. At the end of this lesson, you will understand the barriers to communication and how to use conflict resolution and de-escalation skills to resolve incidents.
Think about this. An inmate is talking on the phone. They receive the news that their spouse wants a divorce. This enrages the inmate, causing them to slam down the phone and raise their voice. How could an officer de-escalate this?
Challenges to effective communication. Communication between an officer, inmates, and others is effective and successful when actual and potential barriers are recognized and addressed immediately. There are many verbal and nonverbal cues to be mindful of as situations unfold, and there are strategies for conflict management that can be tailored to your duties. Each situation is unique and should be approached with patience and empathy. The following barriers may result in miscommunication: use of profane, derogatory, or disrespectful language; stereotyping; use of derogatory hand gestures or body movements; stress and fatigue; inability to communicate in the same language; lack of cultural understanding; failure to actively listen; use of jargon; tone of voice; Negative attitude. Environmental distractions, such as background noise.
In particular, you should try to minimize barriers to communication when people have physical or psychological disabilities or conditions. For example, you will need to speak louder for someone who may be hard of hearing. Some steps you can take to prevent common barriers to communication include the following. Maintain appropriate eye contact so that you can read nonverbal cues. Keep sentences brief and to the point. Short sentences minimize distractions, especially in stressful, confusing, or noisy situations. Give clear and specific commands. For example, stand next to your bunk is clearer and more specific than move over where I can see you.
Use open-ended questions, not yes or no questions, to promote communication without limiting the other person's responses to short or one-word answers. Allow the person to give their side of the story. Treat everyone with respect.
Understand that there will be times when communication barriers will be beyond your control. However, using the above communication strategies may help reduce the frequency of these occurrences and help you manage conflict. Managing conflict. Correctional officers often need to mediate conflicts between people, and conflict resolution skills are a vital part of temporarily or permanently resolving a conflict before it can escalate. Properly managing conflict creates an opportunity for the people involved to be more open to a resolution and can lead to better awareness and understanding between people.
While a correctional facility is a controlled environment, there are still many situations that could potentially escalate to violence if they are not properly managed. For example, conflicts can arise due to the following: assigning and reassigning bunkmates, arguments over canteen items and personal property, work assignments, interpersonal conflicts, family disputes, identification cards, mail from delays or disputes, meals, medical services. If an inmate feels they are not being treated properly by the medical staff.
To manage conflicts effectively, you should employ active listening, understand human and cultural diversity, and practice self-control. You must also be well informed of the law, your authority, and how to appropriately apply both to a situation while remaining unbiased and calm as you provide assistance. You may diffuse a situation through conflict management by taking the following actions. 1. Separate the people involved. Make sure that each party is in a safe location and that they cannot communicate with one another. 2. Gather information from all sides. Allow people to give their side of the story. 3. When appropriate, explain what you are doing and what the people involved can do. 4. Provide options and available resources. 5. If possible, help mediate a compromise. 6. Tell the people involved why you are or are not taking action. 7. Act with dignity and preserve people's sense of dignity.
Determine if the conflict can be resolved or only managed. Know the resources available to manage the conflict and bring it to an appropriate conclusion. Never make concessions or promises that you cannot keep. Establishing order by guiding the people involved in the dispute toward a peaceful end should be the main goal. However, keep in mind that not everyone may agree with the solution, so offer compromises when possible. There are times you will be required to respond to situations that have escalated into violence or have the potential to do so using de-escalation. De-escalation refers to reducing the intensity of a situation through the combined use of communication, active listening, and empathy. An important component of de-escalation includes slowing down a situation before it can spiral out of control. The goal of de-escalation is to obtain compliance without using force or by using the minimum force necessary. Sometimes managing conflict requires actions such as calling for additional personnel or redeploying resources. It may also require issuing strong verbal commands or using a show of force or actual physical force to establish control.
These actions, along with others, are commonly referred to as de-escalation techniques and are designed to bring a volatile situation under control so that other techniques, such as mediation and arbitration, can take place. Finally, de-escalation plays an important role in liability, gaining compliance without using. Force reduces use of force incidents, and by extension, that reduces excessive force complaints. De-escalation provides better legal protection for both you and your facility.
Remember, you cannot successfully manage situations that are not under control. But through your knowledge of de-escalation and use of de-escalation techniques, you may regain or establish control of the situation so that dialogue and mediation can occur. Unfortunately, not all conflicts can be brought to a peaceful conclusion. Sometimes, you may need to take enforcement action, such as reclassifying an inmate or putting them in confinement. That is why you must know the limits of your skills, the law, and your authority, while appropriately applying this knowledge to any situation.
Emotional intelligence. Along with de-escalation techniques, it is important to use your emotional intelligence to resolve conflicts effectively. As you may recall from Chapter 1, emotional intelligence helps you to recognize and manage your emotions while understanding the emotions of others. When emotions are heightened, people tend to make less rational decisions. Conversely, people who are able to maintain control over their emotions are more likely to make thoughtful and rational decisions. When you have emotional intelligence, you are able to understand your emotional response as well as others' emotional responses, and use this information to de-escalate or prevent the escalation of an incident. In situations where there is a risk of escalation, it is advisable to have support staff intervene and remove the agitated person from the equation.
To effectively handle a conflict, take into account your own emotional state and recognize when it might be affecting your decision-making. If you start to feel angry or emotional, you can practice self-control and calm yourself. Take a moment to pause and reset your response. Officers should remain calm and remove aggressive people from the situation to allow for a more reasoned approach. It is also important to consider that having an audience can make a situation worse, so isolating a person may be a more effective strategy for calming them down while allowing them to maintain their dignity. It is essential to pay close attention to the behavior of people involved in a conflict and to actively listen to their concerns. When appropriate, it may be necessary to provide a fellow officer or co-worker with the resources to help them manage their own emotions and cope with a situation. It is important to communicate that it is part of the human experience to struggle with emotions, and it is okay to seek assistance and support when it is needed. Your agency should have available resources for employees seeking help with emotional and mental health concerns.
Page 87, Unit 2, Advanced Communication Techniques. Lesson 1, Manipulation and Deception. Lesson Goal. At the end of this lesson, you will be able to recognize what manipulation and deception are and how to respond to them.
Think about this. An inmate asks an officer, "How is your son feeling today? I know he was sick yesterday." Why would this be a problem in a correctional setting? While carrying out your duties, you will become familiar with the inmates under your supervision. It will be normal for you to interact with them every day, and they may attempt to be friendly with you or ask you questions that appear to be innocent. However, you must be mindful of the intent behind all interactions, as some inmates may attempt to manipulate or deceive. You should also be prepared to shut down any attempts at manipulation or deception as part of ensuring safety and security.
Manipulation is the act of controlling or influencing another person's behavior to gain a personal benefit or advantage. Inmate manipulation occurs when an inmate attempts to get what they want by influencing another person to do something that they would not ordinarily do. Manipulation can be an isolated incident or an ongoing series of events and may result in more severe consequences for the officer, staff, or inmate. Deception is the act of lying to, misleading, tricking, or fooling another person. It may happen at the spur of the moment or may be a habit. It can be difficult to distinguish between manipulation and deception, but the ultimate goal of both is personal gain or avoidance of disciplinary action.
Assume an inmate asks an officer one of the following questions. Did you watch the game last night? Would you like a candy bar? Do you have a cigarette? You smell good. What cologne or perfume are you wearing? While these questions may seem harmless, they could be the beginning of manipulation or deception by an inmate, and you should know how to recognize and handle such questions. When manipulation or deception occurs, you are being controlled, and that jeopardizes the safety and security of staff, visitors, and inmates. Note, if you give in to inmate manipulation and deception, you may face disciplinary action, termination, and even criminal charges.
Deception and manipulation can take many forms, so it is important to be vigilant and observe other people's behavior and communication. Methods that inmates use to manipulate and deceive can range from subtle to extreme and may include attempting to create bonds with staff members, an inmate going above and beyond expected job duties in an attempt to get a favor or special consideration, circumventing or disobeying rules, testing the boundaries of the supervising officer, using special circumstances or situations, using a disability or illness to gain preferential or special treatment, distracting staff, creating a diversion to distract, attempting to engage staff in casual, non-job-related conversation, requesting personal information regarding staff, such as asking where you are from, what school you attended, your age or marital status, the number of children you have, or your favorite sports team, spreading rumors about staff or attempting to turn one staff member against another, discussing information about staff members with you. I heard the sergeant talking about you yesterday, and he said that you were lazy. Over-familiarizing with staff, knowing enough about you to notice a change in your routine, attempting any illegal activity, bribing, blackmailing, or offering sex. Keep in mind that sexual contact between an officer and an inmate is sexual misconduct under PREA standards and is not tolerated.
When an officer maintains a consistent professional appearance and effectively performs their duties, they reduce an inmate's opportunity and ability to attempt manipulation. Always follow your agency's policies and procedures. They are in place to keep you safe and to reduce the effectiveness of manipulation attempts. Inmates may coordinate and execute a plan to manipulate or deceive you or others, whether as an individual or as part of an organized team. The participants of a team may consist of, but are not limited to, observers, contacts, runners, turners, and point men.
Observers watch for correctional officers who use inmate jargon, ignore minor rule infractions, play favorites, enforce rules for some and not others, or are easily distracted. Contacts supply information about a correctional officer's work habits, likes and dislikes. Runners are usually the only paid members of the team because they must expose themselves to the correctional officer by asking for small items like candy, cigarettes, or pencils. Turners befriend a correctional officer and then use the friendship to ultimately coerce the officer into engaging in rule infractions. Point men stand guard when the officer is in the process of granting illegal favors, violating facility rules, or being compromised or harmed.
Whether targeted by an individual or a team, you will be subjected to inmate manipulation and deception. You must also be able to recognize when other staff members are targeted by these tactics. By staying alert and focused, you can stop manipulation and deception. If you notice signs of a coworker being manipulated, it is important to inform a supervisor Remember that you may be more susceptible to manipulation by inmates if you are not in a good mental or emotional state. If you are struggling with your mental health, please do not hesitate to reach out to someone or make use of agency resources.
To avoid inmate manipulation or deception, refrain from being overly friendly or giving out personal information, and do not do any personal favors for inmates. Similarly, under no circumstances should you or a staff member engage in sexual conversations or activities with inmates. Engaging in any of these actions with inmates poses a serious safety and security risk to yourself and your facility. Moreover, it could result in professional, civil, or criminal action. Another situation to avoid is giving one inmate authority over another inmate. This dynamic creates a power structure that can be exploited and generates a hostile environment. Behaviors you should display to avoid inmate manipulation include the following: maintaining a good working relationship with your team, following rules and procedures, observing remarks, gestures, and actions, communicating with supervisors and coworkers when you suspect a problem, knowing your role and performing it properly, documenting incidents, learning to say no and meaning it, addressing inmates by inmate or by last name to maintain a formal distance, restricting your relationship with inmates to activities and discussions that are part of your official duties, being vigilant, but being careful of hypervigilance, being truthful, being professional, being cautious.
Be aware of signs of manipulation and deception used by visitors and volunteers. Visitors may bring gifts or offer favors to staff, or use intimidation in an attempt to get staff to violate facility rules. For example, a visitor may threaten to harm a staff member or their family, or report the staff member to a supervisor. Volunteers include anyone who provides a service to the facility without a salary. This can include chaplains, AA groups, pastoral staff, instructors, or program and charity leaders.
Professional boundaries are the policies and rules that define the relationship between inmates and officers, and they typically include both emotional and physical safeguards from harm. Establishing professional boundaries is essential to keeping interactions between correctional officers, staff, and inmates professional and respectful.
Furthermore, they help prevent officers from overstepping and causing potential harm to inmates or themselves. You must recognize that there is a difference between treating inmates respectfully and being their friend. You can treat inmates with respect and civility, while still prioritizing strong professional boundaries. Maintaining professional boundaries. Every officer is potentially susceptible to manipulation and deception, which is why it is so important to continuously uphold your professional boundaries. You can work on maintaining your professional boundaries by doing the following: being mindful of potential behaviors that may constitute crossing a boundary, improving your emotional intelligence so that you do not become emotionally involved with inmates, seeking help from your supervisor and asking for feedback when you feel unsure if a situation constitutes a boundary violation, acting in accordance with agency policies and codes of conduct, dressing neatly and professionally, shutting down inmates when they attempt to test your boundaries. Examples include responding to a compliment from an inmate by telling them that it is not appropriate, documenting inmates' attempts to test your professional boundaries or manipulate you so that other correctional staff can be on guard.
As you practice upholding your professional boundaries, you will become more effective as a correctional officer. Watch for signs of potential boundary violations from fellow officers and correctional staff. It is your responsibility to speak up if you witness unethical behavior from fellow officers and other staff. If you think that a fellow officer or staff member has not violated boundaries yet but might be at risk, it is okay to talk to them about your concerns. Pull them aside and let them know what you see and why you are concerned.
Note, if you have reason to believe that a staff member has violated their professional boundaries, that behavior must be reported to your area supervisor or higher.
Page 91. Unit 2, Advanced Communication Techniques. Lesson 2, Core Communication Competencies. Lesson Goal. At the end of this lesson, you will understand the importance of using the core communication competencies as a correctional officer.
Preparing for an interaction. Before having a conversation or responding to an incident, there are several techniques and strategies that can help you mentally prepare for the possible interactions that you may have as a correctional officer. These include self-talk, self-awareness, and self-de-escalation. It is important that you practice these techniques and strategies so that you can stay calm and in control of your emotions, ensuring they do not dictate your words or actions regardless of the situation. Self-talk is the practice of talking to yourself as you anticipate, encounter, or evaluate an event. It is often an internal process that can be used for self-reflection or self-improvement. Self-talk strategies for a correctional officer include recalling skills and information learned during training, applying agency policies and procedures, and visualizing a professional response. Visualizing the conversation can help you remain objective in a difficult situation by keeping your thoughts, verbal and nonverbal communications, and emotional responses in check while you assess a situation and complete tasks. When practicing self-awareness, you should be aware of your own perceptions, assumptions, and limitations, and, at the same time, acknowledge that others have perceptions and assumptions about you. Use self-awareness and empathy to remind yourself that whoever you are interacting with is a person too, and likely has similar needs and wants as you. Remain open-minded and sincerely listen to the person you are speaking to without imposing cultural biases and values on the speaker. Focusing on the things that you have in common will help you resist thinking about the other person in stereotypical or derogatory terms.
Using self-talk and being self-aware will allow you to be a calming presence and help keep your emotions from escalating. When you are on the receiving end of profanity or name-calling, remind yourself that people are attacking the profession and not you personally. Keep your focus on the behavior rather than the language. For example, inmates may glare or scoff while standing aside during a bunk search. However, if they have complied with commands and are standing still and orderly while you search the bunk, then what matters is that they followed directions regardless of how they feel about you or the situation.
Practice self-de-escalation to help you stay emotionally strong, even under considerable stress. A key component of self-de-escalation is self-control, which allows you to detach from your personal feelings regarding a stressful situation or encounter. Practicing self-control means you will also be able to maintain your composure. You recognize when you may be becoming emotional, but you take steps to calm yourself. For example, if someone reacts negatively to an officer's authority, an officer with self-control and self-awareness would recognize their own feelings about the situation, but not act on them because they understand that it is not a personal attack. By applying self-control and self-awareness in the situation, the officer can regulate their emotions and avoid reacting negatively in return.
Understanding and identifying your emotional triggers is crucial for maintaining self-control, and being aware of what situations, words, or actions can lead to specific emotional responses will allow you to develop strategies to manage your reactions. Knowing and overcoming your weaknesses will help you gain and maintain self-control. When presented with a stressful situation, it is recommended to do the following. Breathe smoothly, deeply, and evenly to maintain your composure. Exercise self-control over your actions and reactions. Precisely execute your duties to help preserve your self-control. Keep a professional attitude and maintain command presence. Be aware of the things that irritate you. Maintain an impartial outlook on the situation.
When an officer loses self-control, a situation can quickly deteriorate and lead to negative outcomes. Every correctional officer must learn to practice self-talk, self-awareness, and self-de-escalation in order to effectively carry out their duties. Doing so will lead to more effective communication and overall sound decision-making. Failing to manage your triggers, on the other hand, can potentially compromise your safety and health. Core competencies. Every correctional officer should demonstrate the following 10 core communication competencies while performing their duties. These competencies will help you communicate and may also help you avoid volatile situations.
Introduction. Taking the time to introduce yourself and to explain the purpose of your interaction can establish a sense of trust between you and the person you are speaking to. It can set a positive tone for the conversation and help the other person feel more at ease and open to engaging with you. These simple acts can make a significant difference in how an interaction unfolds. Environment and audience consideration. Although you will treat everyone with dignity and respect, be mindful with whom and where you are speaking. Be empathetic and culturally sensitive. For example, if a person does not speak your language, or is hard of hearing or deaf, be patient and attempt to provide that person with an interpreter. Implicit bias. Remember, implicit bias is the unconscious beliefs we have about groups of people. It can shape our perceptions, attitudes, and behaviors without us realizing it. It is important to recognize that these biases can impact our decision-making in various settings, such as in the workplace or in social gatherings. When we take a moment to reflect on what implicit biases might be at play in a given situation, we are better able to make fair and objective judgments. Appropriate questions. Asking the right questions can improve understanding and lead to more effective communication. When you ask thoughtful and relevant questions, you encourage others to share their experiences, perspectives, and any information they might have, which provides you an opportunity to clarify any uncertainties and verify the accuracy of the information you have gathered.
Active listening. Active listening involves focusing more on listening than talking. Listen so that you can gather important information, such as who, what, where, when, why, and how. Listening will help you communicate better when you need to speak. Nonverbal communication. Understanding the subtle differences between a person's spoken words and their nonverbal communication will improve your ability to communicate effectively. One of the things that makes communication so powerful is not only what is expressed, but how it is expressed.
Self-awareness. Being aware of your own thoughts and behaviors can help you control yourself in a difficult situation. Self-awareness ties into your overall emotional intelligence. As you improve your emotional intelligence, you become more aware of how you might react in a variety of situations. Having this awareness contributes to your overall safety because you will know how to prepare for the different situations you will encounter. Self-de-escalation. It is important for you to be aware of when you are at risk of becoming overwhelmed, and you must be able to self-de-escalate when you find yourself becoming angry or emotional. Be sure to take some time to pause and reset your response. This process may include withdrawing from the conversation or having a fellow officer relieve you. Remember that experiencing extreme emotional stress can impact how you communicate with inmates and staff. If you find yourself struggling with your mental or emotional health, please reach out to your agency's resources for support. Remember that you are not alone and there is help available. Procedural justice. Procedural justice is an approach that focuses on making decisions and following processes in a fair and equitable manner in the criminal justice setting. Including procedural justice in your communications with inmates or the public can mean the following: explaining your actions, giving the other person a chance to speak, treating people with respect, remaining transparent in your actions. Appropriate conclusion. At the end of any interaction with a person, whether action is taken or not, conclude by explaining what action will be taken or not taken, and why. As mentioned earlier, leave the person with their dignity intact and treat them with respect.